The people of Pomalong in South Africa's Free State are singing about a friend called antiretroviral therapy, or ARV.
And we are just not singing for fun, we are just letting people to know that AIDS is real, né? HIV is real.
The clinic choir was the brainchild of Sister Sudi. Most members are HIV positive and benefiting directly from the Free State's recent rollout of ARVs.
The choir at Pomalong is a very unique voice. It's a young voice, it's a black voice, and they speak very clearly and passionately about AIDS and about ARVs. And that's not a message that we're hearing at the moment in South Africa, despite the rollout being some 18 months to 2 years down the line.
The Free State has a well-developed relationship between provincial policymakers and academic researchers, who are critically evaluating the rollout in places like Pomalong.
When we started to plan this whole antiretroviral program, we selectively approached people to please come be part of the team, and from day one that we can start looking at different research projects, and that they can apply these skills to help us in areas where we know we don't have strength, particularly in the area of monitoring and evaluation.
Part of that evaluation is a major survey being conducted by the University of the Free State of patient experiences of the government's ARV program.
The people that we have interviewed since last year, really they are living a positive life. The people that we are meeting now, they show that their health is improving. And then most of them are very happy about this treatment that they are having from the government.
Before receiving treatment, people like Stompy must complete a drug readiness program, teaching them how to take the ARVs. But this sometimes causes delays of weeks or even months. Not surprisingly, Stompy feels blessed she's one of the lucky few receiving life-giving medicines for free. But like many others on the program, she wants to see it sped up and greatly expanded.
She says that since taking the ARVs, she hasn't experienced any problem up to so far. But if the government could afford to extend this program to the other clinics as well, not only to certain clinics.
The problem that we have picked is that after these people have finished their readiness training, it takes a long time before they can get their treatment, to an extent that some of them do die before they can be able to get the treatment. So they think if maybe the system can be speed up, then it would be better, that most lives can be saved.
Those people selected for the program are those with a CD4 count below 200. Some of them coming to 10 to 5 or whatever. And they are in the last stages of their life. If there is a delay of 3 months, then you can imagine a huge percentage of them will die. And that is happening indeed.
Across the province, 350,000 people are infected. 48,000 have AIDS, but only 16% of them are currently on ARVs. So research is proving vital in helping the government find ways to speed things up.
We've identified 2 major bottlenecks in the system that I think that the researchers made us attempt that there's a problem, and we need to address it. Particularly our drug readiness program, we need to redesign that totally so that we can have a greater flow through of patients. And secondly is, at the moment, the doctors are the only ones who can prescribe the treatment. And I think if we want to unlock this thing, we either have to get more doctors, which there are not many around, or we have to start looking at nurse-initiated training. So that's one of the things that's on the card for us to start debating.
The demand is too big because our national government delayed this process for 5, 6, 8 years. So a huge backlog developed there. And that's not manageable now.
Dingy van Rensburg is a long-time collaborator with the provincial government in the Free State. His team is working on a series of publications, some with damning findings about deficiencies in the province's ARV program. Alongside positive feedback, one draft paper identifies many serious problems, including a lack of leadership, a flawed national-provincial relationship, insecurity in drug supply, chronic paralysis in decision-making, and breakdowns in coordination and communication.
Our criticism is cutting to the bone. And our research is saying this, and we are saying it bluntly. And I don't know to what extent will the policymakers, the high-level managers, be able to digest it really in a positive way. We don't mean any harm with it, but in effect, the research may do harm to this relationship.
I think if I have a look at the criticism that's been leveled against us, I think it's quite valid, you know, in terms of looking at what was the ideal and what you should have done compared to where we are at the moment.
Part of the strength of this particular relationship is that both sides are very candid, particularly about the tensions caused by critical research findings.
So it's this balance between access and freedom of speech. Now, the academics can say things and criticize who they want to. Obviously, in the process, might offend a whole lot of people, which then closes doors to the researchers.
So there's definitely a tension between your role as a development agent who is supporting a department and heavily committed to making the program work with the department, and your role as a researcher who is required to report without bias on how things are going.
Apart from their research projects, Lara Farrell and her team produce guidelines and train nurses for the provincial government.
We try to use research methodology as a form of protection against this, as a form of introducing objective and reducing bias. So we are doing a randomized trial of our training intervention. But alongside our trial is the qualitative work. And so the qualitative work, obviously the way that we report on that is subjected to some bias.
Caught between the academic freedom of research and the political reality of government, the widely respected Ron Chapman now scrutinises all potential publications.
What's important from my point of view, any publication that comes out of our collaboration, I first see that and I scrutinise it for what can go out or not. Now, obviously that causes unhappiness amongst the researchers, but I think at the moment is if you offend, then you might have no access.
Despite the tensions in the province over the scaling up of the ARV rollout, both sides want to keep this evidence-based relationship alive. But with the risk of censorship so real, what's motivating researchers to hang in there?
Feeling that you're doing research that's actually relevant and addressing actual needs as opposed to, just driving publications.
Pomelong's HIV-positive choir is soon to embark on a major tour of South Africa's Free State, encouraging others to get tested and seek treatment. And if the evidence currently informing health policy here has any impact at all, the new candidates for treatment will not die waiting for their ARVs.